the take-home message of this paper that, as I mentioned before, is really has been a mastodontic type of work because it took me over 5 years of work to put together this 80 sample, do this careful analysis. We have, I think, over 25 tables of data in our supplementary information in the PNS manuscript where we report all the detailed and thorough analysis that we have performed. But for the clinician, right, taking care of this patient, that I think is really important to know that my recommendation is to sequence this tumor because once again we need to know our enemy. That really we must have a deep knowledge of the genetic characteristic that makes this tumor so aggressive. And if we are able to identify amplification in specific gene, deficiency in the MEK pathway, deficiency in the poly epsilon function, or in the mismatch repair gene, of course, we immediately have the opportunity to treat our patient using FDA-approved drug. And again, this is important because this is of immediate use for the patient. So we don't need to wait for trial. We have this drug available. And again, in oncology, as we know, a large number of drugs are used off-label. So are FDA-approved drugs specifically indicated for specific type of cancer. But when the same molecular characteristic is present in other tumor, we may be able to use these tools. In the last few years, the FDA actually has changed the way that they approve drug. We have now multiple agnostic approval specifically to be able to do what I just told you. So if you were tumor that have a TMB above 10, it doesn't matter if they are ovarian, endometrial, liver cancer, or colorectal. The possibility to use an immune checkpoint inhibitor such as pembrolizumab is there because the FDA has approved that indication. And similarly, again, for other biomarkers, when it doesn't matter what type of solid cancer overexpress it, the presence of that biomarker allow you to treat the patient with, again, an antibody or an antibody drug conjugate. So I think this is important and probably is the most significant take-home message of this paper, showing that for the expert, again, this is a comprehensive analysis of the genetic characteristic, and really is, I say, is the platform where we can start really studying in great details the two different subtype and molecular level. But for the clinician, I think that the important take-home message is that there is indication that some of these alteration, mutation in gene pathway amplification can be targetable now with what we have.